Welcome to all the viewers and listeners. I am Stacy Carmichael, and today I am joined by Chairperson of the GPHC COVID-19 Taskforce, Dr. Tracy Bovell. Welcome, Dr. Bovell.
Thank you so much, Stacy, for having us here.
You're welcome. Now let's get into the questions. My first question to you: how is the medical team coping with the management of those critical care patients at the GPHC and at the infectious disease hospital?
So right now at the moment, they are coping pretty well for now. It's just that it seems a bit overwhelming at times, especially when you're having so many critically ill patients. At no one point of time of anyone's career do you want to have people very, very sick. And you always want to see your patients getting better. So it can be overwhelming at times. And it can be heart-rending at times because sometimes you have deaths. And no one ever likes to have a death. No one likes to have a death on their shift. No one ever likes to have a death of any of the patients that you're actually caring for, nursing, any person that you're looking after at any point in time. No one likes that. So it is taking a toll, but so far they're doing pretty good. We're all doing pretty well, ensuring that we are still doing evidence-based medicine care to ensure that they get quality care right here in Guyana.
Thank you very much, Doctor. Now, what has been the biggest challenge over the past few months?
I guess one of the biggest challenges that we've noticing that we are getting an increase in the numbers of patients. And yes, saying that there's an increase in the numbers of patients, people might not totally understand. But you're seeing a number of persons that actually need to be hospitalized. Because before, what you were having is that, yes, you had some persons that need to be seen and they were actually COVID-19 positive, but not all of them needed to be actually hospitalized. And we're seeing numbers increasing drastically, where we're noticing that our intensive care unit, the isolation intensive care unit at GPHC, is actually full to capacity at some times. And before, we would only be occupying one floor of the ICU, but now we're occupying all of the beds in the ICU. And we're trying to shift around to see how we can actually stabilize this patient so that maybe we can step them down, step them to another facility to create space for another patient that can be critically ill. So I think that is one of our challenges at the moment in that trying to see how we can actually turn over the critical patients to cater to more critical patients as time goes by.
Okay, and can you tell us a little bit about the patients who require critical care? Do they all have underlying conditions, and how likely is their recovery?
So with COVID-19 being a new illness, and yes, I still do say that it's a new illness, even though it is COVID-19, which was isolated first or noticed first in December 2019. It's still a relatively new illness. So we do have patients, and the majority of the patients that are critically ill actually happen to have comorbidities, meaning what? Like they can have hypertension, like high blood pressure. They can have diabetes, like high blood sugar. They can have underlying heart issues. They can have underlying lung issues. Some persons have HIV. Some persons have tuberculosis. But we also do have persons that have not had any of these illnesses before, or they would not have actually known that they have these illnesses before and are now being newly diagnosed. So yes, you do have the majority of the critically ill persons with comorbidities. And I guess that's what actually makes their situation a little bit more complex, a little bit more complicated in how you're managing those persons and how you're treating those persons. As into their recovery, we would always like to think that we are going to be able to get everyone to recover. So everyone, it doesn't matter what comorbidity they have, we do everything that's necessary and needed for their treatment. once we're following evidence-based medicine, which is what is guiding our treatment, we're hoping to have full recovery. But there are also the times when you've done everything that you can, and unfortunately, you lose some patients, which is not exactly easy, but continue.
Thank you. Now, we have seen an alarming number of deaths in the month of September. What toll has that taken on the team?
As I've said before, it's never easy to watch anyone die. And sometimes people think that because you're in a medical fraternity and you've seen so many deaths, it's easy. But it's not exactly easy, because you're actually caring for that person. You're there for that person. If they need water, you're there. You give them water. You're checking on their vital signs. You're actually developing a relationship with that person, even with their short stay that they're having with us. And so it affects, each death affects us. Each death affects us, in that you have done everything that you can do. And because of this illness, there's nothing more, your hands are practically tied. And so it is taking a toll, but we have our psychologists reviewing, speaking to our physicians, speaking to our staff. We have social workers, we have persons getting help, and we speak among colleagues, so you support each other. Because it is kind of rough to watch people just die.
I understand. And with that being said, Dr. Bovell, what can you say to the public? What should they do? What part do they play in helping to flatten the curve?
Oh, the public has so big a role. It has a huge role in helping us flatten the curve. They have so many things that they can do. Let's start off with wearing our face mask. And it's not just wearing a face mask, but it's wearing it appropriately, wearing it the correct way, making sure that you cover your nose, your mouth, it covers your chin, making sure that you're in public, you wear a face mask, making sure that you do not take it off, you do not lower it. You can make sure that you wash your hands regularly, because the interesting thing about COVID is that you do not just get COVID by being around someone. You can get COVID, for example, if you're not wearing your face mask. Or if you're wearing your face mask and you touch a surface, and before you wash your hands, you touch your eyes or your mouth or your nose. So you can wash your hands frequently with adequate soap and water. Adhere to all of the guidelines that we are actually putting out there. The Ministry of Health has always been putting out the guidelines. DPI has been putting out guidelines, the health guidelines. Ensure that you do your social distancing. Ensure that you try to avoid mass gatherings. Adhere to the curfew. There's so many guidelines, so many things that are important for you to do. So face mask, wear it appropriately at all times. Wash your hands, social distancing, adhering to the curfew. Yes, your curfew right now says between 9 p.m. to 4 a.m. But that does not mean that from the time you're finished working, you go to party until 9 o'clock. That defeats the purpose. The point is that you're supposed to avoid mass gatherings. If you're drinking beers, most likely you're not going to be wearing your face mask. So do virtual parties. There's so many other measures that you can put in place to still have you can still socialize without physically being there. We have to understand that COVID-19 is here with us, and each one of us has a part to play. It is not just the Ministry of Health's business. It is each person's business, and we have a part to play, and we need to actually do our part.
So thank you very much, Dr. Bovell, for joining us on this interview. It was very informative, and I hope that we can talk again.
Okay.
Thank
you
you.
very much for having me, Stacy.
You're welcome. Thank you also to the viewers and listeners for joining us today. We were speaking with Dr. Tracy Bovell, and she's the chairperson of the GPHC COVID-19 Task Force. Goodbye for now.